Dr. Ajay Satya, first year postgraduate student from the Department of Conservative Dentistry and Endodontics, Sri Balaji Dental College and Hospital, and Bharat Institute of Higher Education and Research. So my topic for today is root canal sealers. So basically, a root canal sealer is an antimicrobial agent, and it is used to fill the discrepancy between the obturation materials and dentin walls. It's also used as a binding agent and as a lubricant, and has an excellent radio-opaque property. So the root canal sealers are classified according to their composition by Engel. So they are classified into eugenol, non-eugenol, and medicated. So under eugenol root canal sealers, we have silver containing, silver free, and Kerr sealer given by Rickert in 1931, and Grossman sealers. Under non-eugenol, we have calcium hydroxide based root canal sealers, resin based root canal sealers, solvent based root canal sealers, and non-eugenol based sealers, glass ionomer, polycarboxylate, silicon based, calcium phosphate based, urethane methacrylate based sealers, and NTA based sealers. Under medicated root canal sealers, so basically medicated root canal sealers have therapeutic properties, and under that we have endofill, N2, and endomethasone and iodoform paste. Now, coming to classification according to the intended use, according to Cohen, type 1 says materials intended to be used with core material. Type 2 is intended for with or without core material or seal. Type 2 is further divided into three classes. That is the class 1, which includes materials in the form of powder and liquid that set through non-polymerization process. Class 2 is they set the two paste that sets through a non-polymerization process. And class 3 is they include polymers and resin systems that set throughout polymerization. So type 2, we have it is further subdivided into four classes. That is class 1, powder and liquid non-polymerizing, paste and paste non-polymerizing, and metal amalgam and polymer and resin systems. So coming to ideal properties of root canal sealer, we have they should have adequate consistency and adhesion to the dental walls, and they should have adequate working time. They should set slowly, for example, sodium borate, and they should have the capacity to produce hermetic seal and easy handling, and radio opacity provided by salts of heavy metals and halogen like lead, silver, barium, bismuth, or iodine. So no shrinkage at the time of set. Significant dimensional changes and continued volume loss can occur in some endodontic sealers. Zinc oxide eugenol sealers begin shrinking within hours after mixing. AH26 is first expanded and showed no shrinkage for 30 days. And finally, they have antimicrobial action. And coming to biocompatibility, they should be tissue tolerant, and that is they should have a tendency to withstand or survive. Then insolubility in tissue fluids, and to allow a retreatment of the canal. And they do not discolor dental tissues. Like zinc oxide, eugenol, endomethasone, and N2, they induce a moderate orange red stain. But and diacate and tubuli they cause a mild pink discoloration. And again, AH26 gave a distinct color shift towards the gray. So then the last two properties are they should have no antigenic action, not to provoke immune response, no non-mutagenic and non-carcinogenic action. So coming to zinc oxide eugenol sealers. So as you can see the composition, it is composed into powder and liquid, and powder has zinc oxide, precipitated silver, oleoresin, thymol iodide, and the percentage are as follows. You can just go through that. And liquid, we have oil of clove and Canada balsam. And zinc oxide eugenol, the advantages is excellent lubricating properties, and the working time more than 30 minutes, ratio 1:1, completely set and become inert within 15 to 30 minutes, thus reducing the inflammatory response compared to other that take 24 to 36 hours to set after working time. And germicidal, they have greater bulk than any sealer. This is ideal for lateral condensation obturation techniques. And it comes with the disadvantage of staining the tooth, rapid setting time in high heat and humidity region. So setting reaction of zinc oxide eugenol sealers. Zinc oxide eugenol sets because of combination of both physical and chemical reaction, yielding hardening of the mixture is due to formation of zinc eugenolate and the presence of free eugenol tend to weaken the set and increase the cytotoxicity. Tactically, all ZOE sealers cements are cytotoxic and invoke an inflammatory response in connective tissue. Advantages: ease of manipulation, plasticity, radio opaque with some germicidal properties, and minimal setting time, accepted working time, low setting time, the absence of moisture, and good sealing properties. And disadvantage: it is not easily absorbed from periapical tissues. Zinc eugenolate has the disadvantage, however, of being decomposed by water through continuous loss of eugenol. This makes ZOE weak, unstable material and precludes its use in bulk, such as for retrofillings placed apically through a surgical approach. Okay. The initial ZOE cement was developed by Rickert in 1931. The silver added for radiophobicity causes discoloration of the teeth, thus creating an undesirable public image for endodontic purposes. Okay, now the next sealer is Grossman sealer, which was found in 1958. It is composed of powder and liquid. That is, powder has zinc oxide, eugenol, stabilite resin, bismuth subcarbonate, barium sulfate, and liquid is of course eugenol. We have and its properties. It has a plasticity and slow setting time due to the presence of sodium borate. Disadvantages is the presence of resin need vigorous spatulation, other with it, otherwise it will lodge on the canal wall. Roth 801 is Grossman's original formula. Roth only add bismuth subnitrate instead of bismuth subcarbonate. Okay, next moving on to Tublicil. Tublicil is manufactured by Cybron Endo. It is a non-staining sealer, and it comes as a base and catalyst. And you can see the composition. Like it is also a zinc oxide eugenol sealer. It's composed of zinc oxide, oleoresin, bismuth trioxide, and radiopacifiers like barium sulfate and thymol iodide, oil, and waxes. And catalyst phase, we have eugenol, polymerase resin, and anidaline. Setting time is 20 minutes, and the root canal, the setting time of the glass slab is 20 minutes, and root canal 5 minutes. So advantages of Tublicil are they are quick and easy to mix, and it's extremely lubricated. Due to its lubricated property, it can be used when it's difficult to the master cone to reach the last millimeter of the preparation, and most importantly, it does not stain the teeth and expands after setting. Disadvantage: it irritates the periapical tissue and very low viscosity and easy extrusion through the apical foramen. Short working time is also a disadvantage of this sealer, and rapid set, especially in the presence of moisture, used when apical surgery is to be performed immediately after filling. The company has reformulated the sealer to extend working time and is now available in auto mix tube that is called as Tublicil Express. TG sealer. And next comes the TG sealer. According to the manufacturer's description, it is zinc oxide eugenol root canal sealer. Again, the powder and liquid, they almost contain the same components as we saw before. The advantages: they do not irritate the periapical tissues. They contain antiseptic and anti-inflammatory additives and does not stain the tooth structure. And they have a very good radio opacity and high adhesion properties, and ease of manipulation and application and acceptable working time. So next comes endofill. Endofill is a radiopaque preparation of permanent root canal filling. Its composition is well tolerated by tissues and it provides anti-inflammatory antiseptic action. Before hardening, the paste penetrates the narrow fissures and maintains its therapeutic effects throughout the treatment until completely set, and maintains its therapeutic and the final obturation neither retracts nor resorbs. Endofill is also available as regular or slow setting composition. So the powder is composed of dexamethasone acetate, hydrocortisone acetate, polyoxymethylene, thymol iodide, and excipient AD 100%. And liquid, of course, it's used in all. So next, moving on to Sea Light Ultra. Is according to manufacturer's description, powder contains enaloxone, diiodothymol, zinc oxide, radiopacifier, silver powder, and liquid eugenol. So the properties of Sea Light Ultra: it contains it's a non-steroidal anti-inflammatory agent with good local and systemic safety. It is used for the relief of post-operative pain following the root canal. Work cement which perfectly fills even the smallest canals, very thin film weakness, no disintegration, very slow solubility, and very high flexibility of handling and adequate working and setting time. Zycal. This Zycal is also a root canal sealer based on Grossman's formula. It's antibacterial, non-inflammatory, and it is used for root canal sealing using GP points, root canal sealing without using GP points, and root canal filling for infected root canals. Again, the composition we have zinc oxide, epoxy resins, barium sulfate, sodium borate, and eugenol as a liquid. Setting time is 5 to 10 minutes, and working time is 4 to 6 minutes. So the product benefits are they are antibacterial and non-inflammatory, and they're based on Grossman's formula, and they're radio opaque and non-staining, and excellent thermal insulation. Now so far we have seen about the zinc oxide eugenol root canal sealers. Now let's go on to calcium hydroxide based root canal sealers. So we are going to see about Apexit and Apexit Plus. So according to manufacturer's description, they are insoluble radiopaque calcium hydroxide cement for the permanent obstruction of root canals in combination with GP points. It does not shrink during setting and demonstrates excellent physical and biological properties. Working time: if no water is added, the working time is approximately 3 hours. The addition of water markedly reduces its time span. And composed of calcium salts, that is calcium hydroxide, calcium oxide, calcium phosphate, and hydrogenase colophony, disalcylate, bismuth salts, and alkyl ester of phosphoric acid. It is not indicated in retrograde obturation, and we should not use Apexit Plus in patients with a known allergy to any of the product's ingredients. Side effects: we have to avoid contact of Apexit Plus with the skin, mucous membranes, and eyes. Unset Apexit Plus may cause slight irritations. And interaction: the setting time of Apexit Plus in the root canal is dependent upon the availability of moisture. The setting reaction can progress very quickly in canals which have been adequately dried. The material begins to set at the apex as dentin is the thinnest in this region, and the apical foramen admits additional moisture. Thus, even when using Apexit Plus, you have to make sure to thoroughly dry the root canal system prior to performing the obturation. Apexit Plus may remain soft for several days depending upon the humidity. Ambient humidity. The setting time of Apexit Plus is between 2 and 5 hours. In very dry canals, the setting time can be more than 10 hours also. Okay, next moving on to Seal Apex. Seal Apex is a calcium hydroxide, again calcium hydroxide based root canal fillers. It has a base and a catalyst which is composed of zinc oxide, calcium hydroxide, butyl benzene, sulfonamide, and zinc stearate. Catalyst has barium sulfate, titanium dioxide, isobutyl salicylate resin, and aerosol. In 100% humidity, it takes up to 3 weeks to reach the final set. In a dry atmosphere, it never sets. The sealer expands while setting. Okay, so next we move on to AH26. AH26 is a resin-based sealer. So far, we have seen about zinc oxide eugenol based sealers, calcium hydroxide based sealers. Now we come to AH26, which is a epoxy resin based sealer. It's a glue that the base is bisphenol A epoxy resin. The catalyst is hexamethylene tetramine. It contains 60% bismuth oxide for radiographic contrast. As AH26 sets, traces of formaldehyde are temporarily released, which initially makes it antibacterial. AH26 is not sensitive to moisture and will even set underwater. It will not set, however, if hydrogen peroxide is present. It has a very good adhesive property, good flow, a good antibacterial action, and low toxicity and well tolerated by periapical tissues. The addition of a hardener, hexamethylene tetramine, makes the cure resin chemically and biologically inert. The set time is 36 to 48 hours at body temperature and 5 to 7 days at room temperature. So AH plus, the modification of AH26 is the AH plus. Recognizing the advantages of AH plus like high radiopacity, low solubility, slight shrinkage, and tissue compatibility and all, as well it has certain disadvantages also, like the formaldehyde release and extended setting time and staining of the teeth. So a new material called as AH plus was manufactured. The AH plus they retained the epoxy resin glue of AH26 but added new amines to maintain the natural color of the tooth. And shade and color stability make it a material of choice where aesthetic demands are high. AH plus comes in two paste system, paste A, paste B. Paste A contains epoxy resin, calcium tungstate, zirconium oxide, silica, and iron oxide. Paste B is adamantinamide and dibenzyl 5-oxanone diamine, 1,9-TCD diamine, and calcium tungstate, zirconium oxide, and silica siliconide. AS Plus has a working time of 4 hours and a setting time of 8 hours. It half the film thickness and half the solubility of regular AH26 may be removed from the canal if necessary. In a comparative toxicity study, AH plus was found to be less toxic than the regular AH26, and it is easy to mix and it adapts closely to the walls of the prepared root canal and provides minimal shrinkage upon setting. Yeah, calcium release is absent due to the absence of release of calcium hydroxide by Duarte et al. In 2003 suggested addition of 5% calcium hydroxide, so it leads to low viscosity of the material as well as it provides more alkaline pH and calcium release. This higher alkalinity and enhanced calcium release leads to improved biological and microbiological behavior, as a more alkaline pH favors the deposition of mineralized tissue and exerts an antimicrobial action. Now, moving on to urethane dimethacrylate sealers, we have Resilion, which is also called as Epiphany Real Seal and manufactured by Cibron Endo. It contains urethane dimethacrylate, polyethylene glycol dimethacrylate, bisphenol A dimethacrylate, and silane treated barium borosilicate glass, barium sulfate, silica, calcium hydroxide, peroxide, and photoinitiators. So sodium hypochlorite it comes with a self-X prime. Sodium hypochlorite may negatively affect the bond string. The last irrigation should be EDTA and sterile water or chlorhexidine. When obturation is complete, the coronal surface may be light cured for 40 seconds to create the coronal canal. So next, coming on to glass ionomer based sealer, we have Keytac Endo. The advantages are ease of manipulation, radio opacity, best bond to dentin, fewest voids, lowest surface tension, and the best flow. Their greatest concern was the problem of removal in the event of retreatment, since there is no known solvent for glass ionomers. It is an experimental sealer. So ceramic based sealers, we have MTA based sealers and ProRoot MTA. MTA was developed by Dr. Mohammad Torab bin Ajay in 1903. Its composition has white and gray color. Gray has dicalcium silicate, bismuth oxide, calcium sulfate, tetracalcium aluminoferrate. And white has the same components as above, except they lack tetracalcium aluminoferrate. Properties, the setting time is 2 hours and 45 minutes. pH is 12.5 when set. So it has biological and histological properties similar to calcium hydroxide. And it also has high compressive strength and produces hard setting on non-resorbable surface. It sets in a moist environment. So therefore it is hydrophilic in nature. Low solubility, uh, low solubility which provides resistance to marginal leakage. And it is biocompatible also. The mixture is loose granular aggregate, so it does not stick to any instrument, cement or amalgam carrier, unless compacted very lightly. The loosely bound aggregate will be pushed out of the cavity. Bacteriostatic also is a property of MTA root canal sealer. Disadvantages is they are difficult to manipulate, their long setting time, and they are very costly. So they are indicated in apexification, root absorption, root perforations, pulp capping, and root end material. Okay, the precautions to be taken while using MTA are the MTA material should be kept in closed container to avoid moisture. They should be stored in dry area. Material should be immediately placed after mixing to prevent dehydration during setting. Working time is about 5 minutes. If more working time is needed, the mixed material should be covered by moist gauze to prevent evaporation or add small drop of water during condensation technique. So next to MTA, we have biodentin. So it is based on active borosilicate technology. Tricalcium silicate, it has tricalcium silicate core designed to treat damaged dentin both for restorative and endodontic indications. Advantages of biodentin are they are biocompatible, eliminates the risk of adverse tissue response, helps to preserve pulp vitality by promoting reactionary dentin genesis, and they reduce the post-operative sensitivity by its outstanding sealing properties and is easy to use, compatible strength and quick setting. Usage, they can be used in deep class 5 cavities and restore endodontic access cavities and indirect pulp capping. So the disadvantages are their fast setting may lead to cracks in the side and side inside the hardened biodentin, have no long-lasting antibacterial action. This action exists only during setting time in 10 to 12 minutes. Setting of biodentin is based on chemical reaction between calcium silicate powder, which proceeded fast. Slow setting ensures a high pH, which is maintained for a long time. So these are the new root canal sealers which were found recently. The nano-sized bioceramic sealer, iRoot SP. It has calcium phosphate, calcium silicate, zirconium oxide, and calcium hydroxide. Uh, iRoot SP includes a similar composition to white MTA, and it can form a hermetic seal inside the root canal and be used for filling of root canals with or without gutta-percha points. Pre-mixed, ready-to-use injectable white hydraulic cement paste developed for permanent root canal filling and sealing application. iRoot SP is an insoluble, radio-opaque, and aluminum-free material based on a calcium silicate composition, which requires the presence of water to set and harden. It has a very good antimicrobial activity, osteoconductivity, and offers excellent hermetic seal in constantly wet environment. Formation of chemical bond within dentin, it insolubility in tissue fluids, expansion during time of set, and has very good radiopacity. So it's composed of tricalcium silicate, dicalcium silicate, zirconium oxide, tantalum pentoxide, calcium sulfate. And bioaggregate is also a new root canal sealer. It is composed of tricalcium silicate, dicalcium silicate, amorphous silicon oxide, tantalum pentoxide, calcium phosphate monobasic. It utilizes the advanced science of nanotechnology to produce ceramic particles that, upon reaction with water, produce biocompatible and aluminum-free ceramic metal.